Good afternoon, Dr. Jenkins. It's Mihira from Post-Op Recovery. I'm calling about Mr. Harrison, the patient who had the laparoscopic cholecystectomy this morning.
Oh, Mr. Harrison. How's he doing? Any post-operative nausea?
Initially, yes, he had some mild emesis, which we've managed effectively with ondansetron. His pain control is adequate with the prescribed PCA, and he's mobilizing well. However, I've noted a persistent low-grade fever, 38.1 degrees Celsius, for the last 3 hours, despite being well hydrated. His heart rate is stable, and his wound site looks clean, no overt signs of infection there.
A persistent low-grade fever, not ideal, but sometimes seen after general anesthesia. Mihira, any respiratory symptoms? Cough, crackles?
That's what prompted my call, actually. While his chest sounds are clear on auscultation, and there's no productive cough, his oxygen saturation has consistently hovered around 93% on room air, dropping to 91% with any exertion. He's also complaining of a slight, generalized discomfort in his chest, distinct from his surgical pain. This, coupled with the fever, suggests we might be dealing with something beyond just post-op atelectasis. I'm concerned about early-onset pneumonia, or perhaps a small pulmonary embolism, given his age and immobility before surgery.
Right, that subtle desaturation combined with a fever is key. We need to rule out anything serious. Mihira, I'd like a chest x-ray and full blood count immediately.
Will do, Dr. Jenkins.
I understand that the word biopsy can sound quite intimidating, Mihira, but I want to walk you through the process to show you how straightforward and gentle the procedure actually is. We begin by carefully cleaning the area of skin to ensure everything is sterile and safe. To make sure you don't feel any pain, I will administer a small injection of local anesthetic. You might feel a brief, tiny pinch, but the area will quickly become completely numb. Once the skin is ready, the doctor will take a very small sample using either a shave technique, which gently removes the top layer, or a punch method that uses a tiny tool about the size of a pencil eraser. While you are likely to feel some light pressure during the process, the entire procedure is very quick and usually finished in just a few minutes. It is perfectly normal to feel a bit anxious, but please be reassured that risks like minor bleeding, scarring, or infection are very low and easily managed by our team. Afterward, we will apply a small dressing, and you can return to your day almost immediately. Mihira, we are here to ensure you are comfortable throughout, so please let us know if you have any questions at all.